Today for EMN5, we're going to talk about transient global amnesia. So you have someone that comes in, you walk into the room, and the first thing is they actually ask you, how did I get here? What time is it? What day is it? Do I need to be at work right now? How did I get here? And then they repeat themselves again. What time is it? How did I get here? You also have a concerned family member who's standing by the bedside and tells you that about 30 minutes ago, the patient was walking into the kitchen, suddenly stopped, became very confused, and was asking these very same questions. Didn't seem to even remember how he got into the kitchen. The family member says they didn't witness any falls, there was no loss of consciousness, no other past medical history that seems pertinent, no history of drug use or psych disorders. And when you look at the patient, you see a slightly anxious guy, but otherwise he actually knows his name. He knows his wife's name. He remembers what they had for dinner yesterday. He can repeat some basic phrases back to you. He's alert. He has a normal neuro exam, but something's clearly off. He just has this lapse in memory and doesn't remember what's happened for about the last 30 minutes. And what does he have? Probably transient global amnesia. So this tends to occur in 50 to 80-year-olds, actually is around 60 to 65 is the mean. And there's really no risk factors. Possibly migraines has been shown in some studies, but that's not even really been well determined. So transient global amnesia is mostly an anterograde amnesia, meaning that the person can't make new memories. There can be a little bit of retrograde amnesia, but it tends to be more the recent past. And they do have a normal short-term recall. So if you ask them to repeat a short phrase or words, they probably can do that for you. However, they have an impaired long-term recall, meaning that if you tell them what time it is, probably 5 to 10 minutes later, they're not going to remember what time it was, and they're going to be asking you again. Which leads to one of the key things that you'll notice in these patients is this repetitive question asking over and over again, where am I? What time is it? How did I get here? So this is kind of the broken record syndrome. So that said, they actually retain a lot of things. So they have normal social skills. They can do complex motor skills. They have normal visual spatial skills. Their language is intact. They're attentive. They're alert. They could cook. They could drive a car. They could give a lecture. They can play a musical instrument. So it's a very interesting syndrome that really the only deficit is this anterograde amnesia, maybe with a little bit of retrograde. They also, and this is very key, they have a normal neuro exam. If they do not have a normal neuro exam, this is not transient global amnesia. You need to be thinking about something else. The mechanism is very much unknown. These are a couple theories, but no one's really clinging to any one of them. Some people think maybe it's a migraine variant, but that said, there's not really a good association with headaches or prodromes, nausea, blurred vision. Everything else that goes with a migraine doesn't tend to seem to go with these. Some people have thought in the past it might be a temporal lobe seizure, but that said, the EEGs are negative in these patients. The probably most common theory is that it's some kind of vascular etiology. TIAs have been thrown out there, but then again, when they've looked at studies of patients that have had transient global amnesia, they're not any more likely, in fact, less likely to have TIAs later in life. So that doesn't really fit because their risk factors are not the same. And there's thought maybe it's an arterial vasospasm, or, and this is probably the best one so far that they've come up with, is maybe a venous congestion. They think that that relates most likely to what they're seeing on MRIs, and it's also associated with the Valsalva maneuver in that if you ask the patients what they were doing before this occurred, it tends to be, and this, again, not well proven, but it tends to be with things that increase, like have a Valsalva maneuver. They were exercising, coughing, anything like that. The TGAs last about 1 to 8 hours, so this is very short term, and they should resolve completely within about 24 hours. Meaning if these patients come into the ER, you should really be holding them until you start seeing improvement because that can help you prove that that's what this is. When the episode is over, they can make new memories again. They will remember their past memories again, but they probably will have this episode, however long the TGA lasted, that they won't remember that segment, so those couple hours, and they probably will never remember those couple hours. So the differential is really important for this because it's a little bit of a diagnosis of exclusion in that you at least have to think about all these other things. So you have to think about things that are drug-induced. For example, maybe the patient took some kind of medication that's a sleep aid, sedative hypnotic, make sure they're not drunk and just having a blackout, carbon monoxide poisoning. Also thinking about seizures. There are these amnestic seizures that can cause very short-term memory loss, but these usually last seconds to minutes, and you get a bunch in a row. And it tends to be more of a retrograde amnesia. Again, make sure that they're not having a TIA or stroke. Anything abnormal on the neuro exam, you should be suspecting more of like a TIA or stroke, specifically visual field deficits, which can also associate with amnesia. So make sure that they have normal visual acuity on their exams and just a regular normal neuro exam. Think about anything metabolic, especially something like Wernicke's or B12 deficiency. Infection, like encephalitis, can cause this. And then obviously any psychiatric disorders. So your workup was mostly to kind of rule out other things. So look for focal deficits on your exam, look for signs of trauma, infection, all the other things we just talked about. The only imaging that's really helpful for this is an MRI. They can actually see some changes in the hypothalamus during and after these attacks. It's probably best to consult neuro with these patients, again, just to make sure that we're not missing something, and they can help recommend imaging too. This is an example of the MRIs, and you can see here in the hypothalamus, there's this little area that lights up. So 3 to remember for transient global amnesia. First of all, this is an interrograde amnesia, meaning they can't make new memories. So you'll see them having these repeat questions all the time, the broken record syndrome. The neuro exam should be normal, and these are going to last around 1 to 8 hours, resolving completely within 24 hours. And number 3, make sure you rule out other things. So consult neurology and consider imaging at their recommendations. Here's some references, and thanks for joining us on EM in 5.